Mitton, over to you.
Thank you, Mr. Chair. My first question was going to be whether you could confirm it's airborne, so thank you for doing that and preempting that. That's important. I want to ask a question about when in July 2021 we moved to the green phase. We had not hit the 75% vaccine threshold that was laid out as one of the public health triggers. It appeared there was a desire from government perhaps to want to have New Brunswick Day and some summer in the green phase, but we hadn't hit that vaccination threshold. Could you speak to whether this was a case of political preferences superseding the public health triggers that had been put in place?
As with all of the decisions that were made throughout the pandemic, the options and recommendations were always presented with pros and cons, and then all the other departments could weigh in on that advice, and then Cabinet would make decisions. So I don't think it's any different than any other situation throughout the entire pandemic.
So there had been public health triggers determined and a vaccine threshold determined, and then this was not followed. Was that part of what you had recommended, that it was okay to not follow the triggers? Or it's hard to understand that decision-making process because it had been clearly laid out and publicized and shared with the public, and then that isn't what happened. So it's hard to understand what changed.
So communications with the public would always involve the most up-to-date information that we had and whatever the latest decisions were made. And I think keeping people abreast of, the new and changing information was important to help people know what was coming next. But every single time we went to Cabinet, all public health recommendations were presented as options with pros and cons. So this was no different. This was not a different situation at all.
Could you speak to how you see your role in relation to the public?
You mean during the pandemic or right now?
I guess both.
During a crisis, the evidence-based information that we received from Public Health Agency of Canada at the time was around trust, building trust with the population, transparency, efficiency, effectiveness in terms of communication. So medical officers of health have competencies in many different areas, including communications. And that communication is extremely important, again, to make sure that the behavioral changes that are necessary to protect the population are able to be understood and to be adhered to. And that cooperation was so evident during the pandemic that New Brunswickers did step up and do what they needed to do to protect each other. Extremely impressive. I'm so proud of how that transpired. In terms of my role right now, as I've mentioned, whatever public health messaging myself or my colleagues need to provide, we do provide it, whether it's written, whether it's in a press conference, whether it's in a scrum, whether it's in an interview. But our job, our role, all chief medical officers across the country, we are to monitor and do surveillance of activities. We are doing risk assessments. We are making sure that whatever public health measures are being promoted, and we always have evidence-based information to make our recommendations. I think when you're in a crisis situation, people are focused on public health, and there are some people who would say that in between these crises, public health is not as visible, you don't hear from them, but we're behind the scenes working on making sure the population is healthy in between these crises, so building resilient communities. So there's a lot of work that public health is doing behind the scenes on prevention, upstream prevention, policies that affect the population at the population level in terms of improving health outcomes, to prepare for the next crisis, whether it's a climate change-induced crisis or another pandemic. Because what we know from the social determinants of health, that 5% of people's health is contributed to by the healthcare system, which obviously the Department of Health is committed to making sure is the best it can possibly be to deliver timely healthcare services to our population. But the social determinants of health contribute to 90 to 95% of people's health and well-being. And so public health's job is to work with our partners in collaboration to make sure that whatever we can do to advance and promote and advocate for improving social determinants of health, that's what our job is. And when I talk about, when people congratulate me on my next role in UNB, my passion is upstream prevention. My passion is population health. So whatever I can do to contribute to making sure the population is healthy, that is my passion, so that is what I'm really keen to do. That is why I came to public health in 2014. Prior to 2014, I was working as a clinician, as a hospitalist, as a family physician, and as working for addictions and mental health at the Methadone Clinic. And so what I took away from my clinical experience was that yes, health services are absolutely necessary, and it's important to provide timely access to these services.
Absolutely.
But at the same time, upstream prevention is really important. So I'm very happy with the work that we've been able to do in public health and health promotion and prevention, including the adoption of some pilot sites for a program called Planet Youth.
Oh, thank you. I hate to interrupt, but my time is running down, and I do have more questions. So my apologies. I hear what you're saying about Planet Youth and upstream prevention. I'm passionate about that as well. Thank you. But I do want to get to a few more things before the time runs out. I want to go back to the question around the green phase in July 2021. Did you tell the Premier that you would support his decision to go to the green phase and bypass the public health trigger around the vaccination threshold?
So every time that a public health recommendation was made, they were presented as options with pros and cons for each one. And even in color phase assessments, again, that information was taken in context with what is the public appetite. Communications would have surveys about how our messages were being received. Public safety would have a pulse on how people were feeling in terms of what they could safely implement in terms of resourcing, et cetera. So every time we had decisions that were made at Cabinet, our recommendations were always presented as options with pros and cons based on the input from all of our fellow the departments that participated in these discussions.
Okay. Would you, I guess, did you present options, or did you present like just, this is my recommendation? Like
there were more than one recommendation for each type of situation. So there was never just one recommendation. So there were many recommendations, and each recommendation had pros and cons.
And so did you propose that as a possible recommendation to ignore the vaccine threshold that had been established and move to the green phase?
Throughout the pandemic, there were many times when New Brunswick made decisions around, based on information that like, for instance, sometimes, let's say NACI, the National Advisory Committee on Immunizations, would make recommendations that we may or may not follow. So we always, our cabinet decisions were that were taken in the context of whatever the information was that we had at that time.
In the, I guess, the late winter of 2022, when I guess sort of mandates were lifted and you know, masking in schools and such, was that recommendation from public health to have that big transition at that time?
Again, the process is the same for each and every situation in terms of information that comes in, recommendations that go to Cabinet with pros and cons and input from all the other departments in Cabinet.
So at that time, well, and I guess this is true of other times as well, but vaccination rates were very low for children. Ventilation systems had not been upgraded in many places, which is still true. Now, I think of schools in my riding, for example, Marshview and Dorchester. Were there recommendations made by public health, for example, to improve the vaccine campaign rollout or to work on ventilation in order to mitigate the consequences of that type of decision-making?
We definitely had discussions with the Department of Education. Again, with any information, new information, with any advice, with any analysis came those discussions. And those discussions included our partners, social development, education, justice and public safety, et cetera. So this process was the same for each and every decision that Cabinet made.
I think for folks listening, trying to understand how some of these decisions were made, it's hard to understand. Okay, we understand information was presented, different recommendations and options and pros and cons, but to get it at some specific decision-making, to get it how that worked, it's difficult to, it's opaque. It's hard to understand. I guess I will, I'm looking at the clock here. I'm going to ask a question about nursing homes. We've talked about schools. I mean, this is a very short period of time, so we haven't been able to touch on many things. Can you speak to, I guess, what happened in nursing homes and whether you think that adequate resources were provided, adequate preparations were provided for nursing homes and other long-term care facilities? And I guess we know that there wasn't preparation early on, but even a couple years, like a year into this, I think of September and October 2021 when there were outbreaks in many nursing homes. Can you speak to what that process looked like and whether you think adequate preparations and resources were provided?
As I mentioned earlier, we were able to benefit from the experience, the unfortunate experiences that were happening in other jurisdictions, so that we could prevent those situations here. And the prompt teams were the solution to those nursing home outbreaks. And those prompt teams were deployed around the province, and they did an amazing job at protecting nursing home residents. We would not have been able to succeed in those areas in terms of protecting that vulnerable population. So I do feel that adequate resources were deployed. Those teams worked extremely hard under really, really difficult circumstances. And again, stringency measures in terms of how to protect people from COVID have negative consequences and negative impacts in other areas. So we do know that it was very difficult for family members. We do know that it was very difficult for the residents themselves. So I feel like the prompt teams were the most effective and efficient way of dealing with outbreaks in nursing homes.
So I do applaud the work of everyone who's worked and volunteered in nursing homes, the prompt teams as well for the work that they did. So about a year and a half into the pandemic, the vaccine threshold hadn't been met and the province had been moved into the green phase, and then less than 2 months later we were back into a severe wave, and there were outbreaks. People were back at school, there were outbreaks in nursing homes. And so while I think there were successes in some people benefiting from some of these things, there were also, like, I think of the people who died at the nursing home, I think of people other places. And I know that the workers were doing everything they could, but I'm concerned, I'm wondering, were the lessons learned adequately shared during that time before the outbreaks that happened at that time?
So the uptake of vaccinations in nursing homes was much, much, much higher than the general population for many different reasons. One, we had resources that went to all the nursing homes to make sure that happened. So if you look at the uptake of residents in nursing homes, off the charts. Is that population still vulnerable? Absolutely. But the thing is that we had the means to vaccinate that population, and we know that vaccinating the population was not a way to prevent deaths, it was a way to prevent hospitalizations. People would still get sick, people would still die, but they hopefully wouldn't need hospitalization, and that was what we needed to do to protect the healthcare system.
Okay. Very quickly, I was asking about the Public Health Act consultations. We couldn't figure out the timeline, but can you tell us what your response was in terms of what amendments should be made in terms of your role?
The times of the discussions, as I mentioned, I mean, this was almost 4 years ago, so the discussions that happened, I obviously, we had fulsome discussions about what should transpire, what could transpire, what would transpire. I don't have any regrets about how that unfolded in terms of the emergency order.
Thank you very much for that. We have very few minutes left, so what I'm going to do is offer each entity one last question and a quick closing comment. All right, so we'll go to Mr. McKee first for your last question and closing comments.
Okay, thank you. My only question that I want to ask is around record keeping. I know that it came out through the Auditor General's review that the COVID Corps did not keep any notes or minutes or anything of discussions taking place. So did you keep meticulous notes of everything and advice, whether to cabinet or to different departments? Is that all kept, and documented?
I have emails in my inbox and my sent box. I have my calendars. I don't recall taking a whole lot of notes. I would have taken some, but I definitely was kept informed and abreast of all the information. I mean, we were going from meeting to meeting to meeting to meeting, and so there was a lot of information that I would have actually kept in my head. And then when it was time to go in front of a camera or do a press conference, I obviously had notes in front of me with that information. So those were my notes because that was the final version of whatever was going to be done.
Thank you. Very brief closing comment, Mr. McKee.
Just very quickly, thank you very much for coming to committee. I know it's not an easy task, and I know it was a hard few years, on everyone involved in the system, and I thank you for your service to the province and wish you well in your next endeavor.
Thank you very much.
Thank you for that. Mr. Collins?
Thank you, Mr. Chair, and thank you, Dr. Russell. I don't have any further questions, but I would like to take the opportunity to personally thank you for your service and all the work and hard work that you had to endure over the number of years seeing us through this. And I certainly wish you all the very best at UNB. They're lucky to have you, and you'll be missed.
Brief as
Thank you.
possible.
Thank you very much.
Thank you. Thank you, Chair.
Ms. Mitton, over to you. A brief question, a brief comment.
Okay. Thank you, Mr. Chair. So my question briefly, I'm wondering, circles back to something from earlier, if you can speak to whether you feel, well, and I think back to like Dr. Cleary's dismissal, do you feel that that has influenced the role of your position? Do you feel like your position has adequate independence from government?
I feel like the structure as it is right now with respect to the Chief Medical Officer of Health being a civil servant and advisor to government, I feel is appropriate, and I have no other comments really to make about that other than there have been discussions with my colleagues across the country about independence versus being part of this civil service structure. I feel it's working well. I don't really have any other comments.
Okay. Well, my brief comment is to thank you for being here. I do think it's very important that you were able to come to Public Accounts Committee this morning, and I do want to thank you for your the work you did in your role. I like I said, I was watching all the press conferences, so I know that you were there on an almost daily basis. So thank you for being here today.
Thank you very much.
Thank you for that. So I would like to also thank you, Dr. Russell, for being here this morning to answer questions.